The idea of AI is to teach computers how to do what humans do best, which is reason, think, observe, make connections, and learn from the past to apply those lessons to the future. And combine that human thinking power with machine power. What do computers do best? They can take vast quantities of data faster than any individual can do it, and do particularly mathematical computations and algorithms much faster than an individual.
You can think of it as falling into three really broad categories. The first is the ability of computers and computer models to aggregate data, thousands or millions of images that can be called up for diagnostic and treatment purposes. The second is machine learning that allows a device or a program to adapt to the individual needs of a patient. For example, determining or highlighting sentinel events such as stroke or sepsis in a hospital or falls in a nursing home or in the home setting. The third is the use of computer programs to recognize voice and speech. That can be very useful in developing medical records and ensuring that medical records are really as complete and accurate as we would like them to be.
The most interesting space for me on it is where it intersects with telemedicine. I know there's been some technological developments that will allow diagnosis and other medical services to be provided via telemedicine and through artificial intelligence. And at the end of that rainbow, it's possible to imagine technologies that are very, very different than how we receive care right now. But where that intersects with state licensing requirements, state requirements for face-to-face interaction, prescribing requirements both at the state level and at the DEA level, those are things that are going to have to be sussed out as the technology develops over time.
Part of the challenge is that AI challenges the traditional regulatory paradigm. In the traditional regulatory paradigm, a manufacturer designs a product, tests the product, develops clinical evidence to support that the product is safe and that it's effective for its intended use, presents that to FDA. FDA can review it, and if it's found to be sufficient, FDA can approve the product. There's an implicit assumption that the product will remain relatively stable over time, that it won't change, and that, moreover, if it does change, the manufacturer will have to present new evidence that that change, again, is safe and effective. AI turns that traditional regulatory paradigm on its head. The whole concept, the whole potential benefit of AI is this concept of continued learning, continued improvement.
One of the issues I think that's inherent in AI right now is what I consider the black box problem. We don't quite fully appreciate how AI reaches the decisions it reaches, and therefore we can't necessarily rely on the output of an AI algorithm unless we truly understand what the data was that trained that AI, how that AI processed that data, as well as whether or not that's an important piece of information in ultimate clinical decision making. I think that leads to the other legal risk, which is always looming in healthcare, which is patient safety risk. So in a traditional medical context, if a clinician has poor judgment or acts negligently towards the patient, we have malpractice. In the context of AI-enabled clinical decision making, it's still unclear about where liability rests if a patient is harmed through that process.
Another potential confounder is there are applications of artificial intelligence that span both prevention and treatment, and the dividing line between a preventive service and a treatment can be very fuzzy. And so this may require rethinking how we cover and pay for these services. Even if we get past that threshold question, the next question is when, where, and how would we cover applications of artificial intelligence? How would we cover it when it's being used in a hospital setting would be very different from how we might think about covering it in the home setting.
Additionally, both manufacturers and investors need to pay careful attention to validation. Whether or not FDA regulates the technology, it needs to work. It needs to produce an accurate, reliable answer over time. This is important both for the benefit of patients and also for consumer confidence, the confidence of the physicians who will use the technology and the patients who, we hope, will be benefited by it. Both doctors and patients need to trust that these machines will give the right answer over time.
Medical technology has historically had a very long curve for adoption. There are early adopters of new technology, but to get to a saturation point where you have, say, 80 or 90% of the entire healthcare economy adopting that can take years. That could be another challenge for adoption of the technology because it's always evolving so quickly. So the early adopters in 3 or 4 years' time may find themselves with an antiquated system.
Ultimately, I think the goal for the healthcare industry is to meet the triple aim, which is improve quality, reduce costs, and improve population health. So AI tools that lend themselves to sort of moving the needle on those will probably succeed in the space. What I envision happening in the future to achieve those aims, I think really relates to, one, being able to more efficiently and effectively extract data and understand it. Currently we have data silos in various places, lack of interoperability among systems, and I think AI is really going to be an avenue to be able to break down those silos and bring data together in a meaningful way.